It's an absolute pleasure to be hosting this panel today, and I firstly want to thank Mydentist for having myself and FMC involved with it. So today's wonderful panel is going to take a deep dive into some of the most important considerations when looking at the future of the profession. That's workforce, that's AI and tech, and it's patient expectations. And as Nari pointed out, we have 10 minutes at the end where they'll be answering your questions, so please do submit this throughout the discussion this afternoon. So to kick us off, workforce. That's recruitment, that's retention, that's engaging and empowering the entire team. So with that in mind, my first question for you today is how important is this utilization of every team member?
Well, I think I'll start.
Yeah.
Listen, I've been advocating for dental therapy and for skills mix for years now, and the more I do that, the more I see the growth in this arena where there is skills mix, the more I can see happier clinicians, better patient outcomes, and crucially, a better income for our practices as well. So I think, all in all, with the way dentistry is going in the UK, the fact that we need access to care, we need people to be reaching self-actualization where they are able to do the work they love to do, I can't see a reason why you would not utilize skills mix more.
Thank you for that. Anybody else want to weigh in after what Kat just said?
Yeah, I fully agree with Kat. I think, as a dentist, as a clinician, the more we can liberate our full team with like a shared care approach, the more efficient we can become and the more motivated our wider team can become. Especially now with the new adoption of many new technologies, which we're going to talk about. There's a whole new learning curve, and that's certainly not like a one single-minded approach. It's a full team approach. And I think the quicker we adopt these new principles and, as I say, really liberate our team with a standardized way to working, a new way to working, dentistry can definitely improve and the patient care can improve alongside it.
Yeah. Thank you.
I'd say for myself, what I've found is with our nurses, they really get to use their full scope. So, for example, our nurses are trained to use the scanner. And what we found is they actually have better conversations with patients because there's that time, that appointment that's not in the dentist's diary or the therapist's diary to actually get to listen to the patient and give that patient-centered approach. So we've actually found that allowing our nurses to do something like that, take the consultations for scans to discuss any cosmetic or any needs that those patients have, allows them then to have a better understanding of the treatments that then they take up.
I mean, I think I'm on the record as saying that even if there wasn't a workforce issue, that actually it's a no-brainer. I think it is something that we need to push into. It's taken us a long while actually to sort of pick it up, really. I mean, Kat will confirm, was it 1963 the dental therapist was created here? And I've just been recently at an international meet where Canada is about to bring in the dental therapists. I've provided some support to the Irish government who are talking about bringing in dental therapists, and we've had it since then. And Singapore is expanding the dental therapist scope from children to adult. And you've heard people talk about, well, we want to develop and we want to work to the top of our scope. So if you want to do that, you need to have someone taking on the bulk of the work. Otherwise, you never really find the time to do so. So I think it's absolutely crucial. And we've started a work stream to push on this, recognizing that whilst from that date to 92, when someone wrote a report that said that this is a really good thing, and we're now sitting at 2025, where actually it's not a private NHS thing either. We've just not been, the whole sector's not been particularly good, but I think it's now time for change and to push that along.
Well, I think also with the introduction of direct access, that's completely changed the conversation, because you no longer have this top-down model where we rely solely on a dentist to refer to us, which never makes sense, because how can that person possibly understand what I feel comfortable and confident doing? It makes so much more sense for me to refer what I don't feel confident with than to hope and pray that someone's going to send me something that's appropriate. So I think actually we can be forgiven for how slow it has been because it's the advent of direct access, or I would probably call it a revolution of direct access that's made it possible.
But even that was 2013.
I mean, that was a long time.
I think it's also important to remember, Martha spoke to us this morning about how progressing and being supported and fulfilling different things in her career provided her with career satisfaction, made her much happier. It is exactly the same for, yes, hygiene therapists, but our nurses as well. It's really important that we develop them, that we allow them to work to their full scope of practice, and actually to make them happier in the workplace, because that makes for a more effective overall team efficiency.
And retention of staff.
Yeah, and retention.
So workforce, as we're talking about retention, recruitment, there is a huge topic in dentistry at the moment is overseas talent. ORE, there's a backlog of people coming through trying to complete that exam, even trying to book that exam. For you guys, how crucial is overseas talent when it comes to helping plug this gap in the workforce in UK dentistry?
I mean, it's certainly from our perspective, it's essential. We have an awful lot of every single year mentees that come into this business that we help through the pathway and then come and stay with us and be clinicians who, I was speaking to a couple at lunchtime, who come through that pathway and then come and settle with us, stay with us for years. And what's important is they're actually providing care for patients where they can't get access to that care. We quite simply don't have enough clinicians in the UK to fulfill the needs of all of the people that reside here. So we absolutely, it's imperative that we have overseas clinicians and we make that pathway easier for them. A lady that I was speaking to at lunchtime, at first I said to her, oh, how long did it, she came through PLVE as it was then, and I said, oh, how long did it take you to pass the ORE? And I was like, oh, hang on, let me reframe that. How long did it take you to actually be able to get an exam on the ORE? And it's just that, it's such a simple thing, but it would make huge differences. And it supports all our clinicians, because if they are under, undue pressure because there's too many patients to deal with the demand in the practice, that's a real challenge.
Yeah, I think, we're generally short of clinicians, but that is actually a worldwide issue. So other countries have the same, but I think that for some time we've relied on that. So there's no question we need to develop that. And one of the things we want to do is to unlock and increase capacity for an exam of some sort to make sure that we can get them through, and that's something that we're trying to push for.
Thank you. And what about career pathways and flexible working models? What part do you think they play in sustaining the dental workforce?
I mean, there's been a huge change, hasn't there, since COVID in particular, in terms of work-life balance of the workforce, but clinicians in particular. And, I think it is important. It can be a demanding career. So for clinicians to be able to pick jobs, the clinician said on the VT earlier that, I picked the practice that suited me, that fitted for me. I think there is now much more openness to flexibility for, people coming back after children, people who only want to work school hours. For us to have our practices working extended hours to therefore allow people to do effectively shift work, so they can do that 8 till 2 and 2 till 8, and it can fit around their life. That's really important for people's mental health as well.
Yeah.
And it's really possible now as well, because we've got such advancements in digital communication and using scanners, in using online clients for our client relationship management as well. Now we can have more flexible working, whereas historically, if you weren't in the office, you didn't know what was going on. But actually, I'm so fortunate to be able to work in a team where there are loads of dentists who I maybe never meet, particularly face-to-face more than once or twice a year, but that's because we all get to work the times, the hours, the days that work for us, and I still know them inside out because we have the ability to do that.
I think it's a patient expectation as well now. Patients is getting, whether we like it or not, and we spoke this morning about customer, we always talk about patients being customers until they're in the dental chair, then clearly they're absolutely patients, but they're customers before and after, and they're now searching for practices in the same way that they search for other things in retail. They are looking for those flexible hours as well, so we actually need to be able to provide that for our patients as well as for our workforce.
Absolutely.
Yeah. I think patients, like you say, patients are patients, but they have expectations of customers.
Yeah.
So as we adapt to technologies and workflows, and we can have new ways of working together with wider teams, like Kat said, we work with clinicians and technicians from all over the planet now. With the matter of seconds, data can be shared, and planning, for example, for patient care can be more comprehensive in much more flexible approach. And those patients can be serviced actually in more efficient ways as well. So adopting to new demands from patients and bringing new flexibility to the way we work and offer new roles within our clinics and environment, which is more aspirational for people to want to step into dentistry as well. So I think it goes full circle.
That's a really lovely segue, thank you, Robbie, into our next section, which is tech and AI. So as everybody knows, tech and AI is developing rapidly, not just in dentistry, but in every area of our life. What opportunities do you think exist today for dentistry, particularly in patient care?
I think for our practice, we use an intraoral scanner. So any new patient has a scan. And how we use that in our practice is to first of all be able to show the patient, okay, this is the state of your mouth, and what do you see? So we take the patients on that journey of understanding where they are. They point out things that they don't like or things that they're curious about. And then as the clinicians, we're able to educate, say, okay, this is happening because of A, B, or C. And then there's that co-diagnosis approach to it. So with tech, it's allowing us to have a more human touch to our relationship with patients. So it's enhancing care.
Thank you.
I think tech also, I mean, talking about the scanner, for me, I also do the same. We scan every patient, but it goes further than the conversation. It's a sort of early intervention tool as well. And also it's a tool that reminds patients where they started. When they are long-term patients with us, we can use that to look back. We're also using AI in our radiographs at the moment, and this is hugely opened up the patient's understanding of what's happening in their mouths. Whereas before I used to have to translate radiographs and it was all on grayscale. Now the patients are asking me, what is this that's going on my teeth? And again, then we can communicate with clinicians all over the world. My implant dentist doesn't live in the UK, but I can communicate with him on an instant basis and say, what do you reckon? Do you think there might be enough space here? Would you like to fly over and place an implant here? And that's all made possible with technology. So without a doubt, I think as long as you're looking at it from a point of education for the patient and engaging the patient, then it's an amazing tool we should be using.
Couldn't agree more. Yeah, it's brought a whole new era of communication, co-diagnosis through visualization and using tools like digitized AI, which massively enhances the patient's experience. Becomes more of a togetherness in that clinical environment where patients clearly understand the treatment plans, adopt treatment plans better, and I say the wider team can get involved. It's a fantastic time for dentistry for not just the patients, but the team. And communication, I think, is everything behind what technology brings to dentistry now.
Thank you.
So, yeah, I mean, I think everyone wants a piece of AI at the moment. Then there is it's sort of dominance in terms of everyone thinking. I think that, as has been said, I think the diagnostic part is really important. We do too much eyeballing stuff, don't we, in dentistry, I think. So having some kind of sort of qualitative, quantitative sort of help in that. So a lot of the administrative and the things that could be taken over, I think, would make things more efficient. And just the communication part, as has been said, I think that's really crucial as well. I think that there is a question as you move into sort of robotics and things like that as to whether things sort of piling one on top of the other, whether the things getting too expensive almost, in terms of going through. So that there will be a ceiling, I think, at some point with that. But for those areas, I think they'll be absolutely crucial. And again, it will go back to the skill mix question, which is if you can take some of the more mundane roles from what the dental nurse does, it will free them up to work to the top of their scope as well.
Exactly, agree with that. I think sometimes people look at tech and you feel like you're going to lose that human touch in practice, but you actually have more time to enhance the human touch because these things are more automated, more standardized, and because we have standardization coming into dentistry for, at a level that we've never seen before, which teams can adopt through good protocol, I think everything can elevate and the patients can see that benefit for sure.
Thank you. Cost is probably a word that's on a lot of people's minds when it comes to this kind of tech. Not all of it is incredibly expensive, but some of it is. So I'd really love to know, how do you stay ahead whilst balancing that cost question?
Should I go first?
I mean, I'm not a practice owner.
No, of course.
And so it's hard for me to really talk to cost as much, but I do have to make my case if I want any new tools or toys to play with. And I think what we have to see is that as technology grows and as time moves on, actually the cost gets less. And certainly when you start seeing, competition is coming in, your costs are reducing, but then you also see benefit. You can see that there's a balance between cost and benefit. And if you can showcase that as a clinician, then obviously your practice is going to be able to hopefully keep costs as low enough for patients, but also keep quality of care as high as possible as well.
Yeah,
There's a lot of factors there, I think. Don't go out and buy every shiny new object you see. And what we say when we're teaching dentists about all this amazing new tech coming into dentistry is most one piece of equipment, whether it's a scanner, a 3D printer, whatever it is you're looking at, it fits somewhere in a workflow. So rather than look at the tech, look at the ROI on the investments in the tech and how that completes a workflow or adds to a workflow, which then brings efficiency to how we work operationally, which then that cost will be returned because chair time efficiency will be higher, profits will be higher. I think that's the best way to look at any investment in the tech now, because there's huge intangibles in that investment as well, because a dentist can't go on a course, learn about a little bit of tech, invest in that bit of tech, and then not think about training the whole team about that whole new workflow that it brings. So that has to be considered as well. But it's a long-term game, not a short-term, loss of cash or capital. I think when we look at that mindset, the return of investment and how we adopt these things is definitely going to be beneficial for most things.
Thank
I
you.
think it's got the two sides to it. I mean, referencing back to the talk that Kosh did this morning where he was talking about digital dentures and reducing it to just 2 visits. So that's your efficiencies piece.
Yeah.
And then there's also the conversion piece, because one, you can, as you said, Arnold, you can illustrate to the patients, they can see what it is that they've got. They therefore are more likely to uptake, because I don't know how many times you've probably said to a patient on a bite wing, oh, there's some decay there, and they go, well, I don't have a problem with it. But when they see it, because AI has kind of made it all shiny and bright, or they see a scanner or an intraoral photograph, that's just much more accepting. So it's kind of putting everything together ultimately in terms of the ROI, as you said, Robbo.
Yeah. I mean, for me, does it make it better? Does it make it more efficient? Does it make it cheaper? And if it does, then it's worth it. Otherwise, don't go for the shiny object.
Robbie, you mentioned skills there of the dental teams that need to kind of complement the introduction of this tech and AI in the workspace. So how is that something that you manage? Why is that so important when considering the future of patient care, that those skills match the tech?
I think for the wider dental team outside the clinician, it's a super exciting time, or it should be a super exciting time. I think the demand to become a dental nurse or a digital dental nurse, or even get back involved in dental technology, CAD/CAM, I think they're the areas that will be thriving or should be thriving in the years to come. They're the areas where we need the help, I think, because as far as clinicians concerned, we need to acquire all the right data for the right reasons for the workflow so we can go and plan comprehensively. But we need our wider team to be able to assist us in this full approach. So that new learning pathway of how we collect data, what we do with the data, and standardize and creating protocols for that, I think in my environment, certainly, it's the nurses, it's the dental therapists, it's what we call nurse techs who are getting involved in 3D printing now. It's a hugely exciting and liberating time for the wider team.
Thank you.
Yeah, I mean, also what Arnold was saying about having dental nurses scanning,
Yep.
and those conversations they're having. What you typically see when you go into practice is if the dentist scans, they are using that scan for their own ends, what they want to get out of that scan. But when you have a non-clinician have that conversation with a patient, it's a totally different conversation, and you tend to see more global treatment planning come out of that, because the patient sees bigger things, wider problems, not just single tooth dentistry anymore, but your full mouth. And I feel like when you introduce different members of the team who don't directly benefit from doing that treatment themselves, from the scan or from taking photos or from taking radiographs, actually the conversations just hit slightly differently. So I'm really interested to see sort of the growth of your practices as well, because I think typically when I go into practices who don't scan, and we move them into, using scanners. Actually, we did a study that said that the treatment plan value increased by 147%. So that just goes to show that, that conversation is so important.
Just following on from that, I'd say one thing we saw was when we introduced our head nurse as the main person for taking scans, our turnover actually doubled in 2 months. And when I look back at what happened there, it's because we were actually setting aside time where the patient is coming in, they're getting scanned, and that nurse is able to talk about everything that they're seeing within that scan. Whereas as a clinician, I'm thinking about my next patient. I'm thinking about, okay, I'm scanning you so we can do A, B, C. But when we just separate that out, we saw a major benefit.
We found that sometimes, again, we adopt the exact same approach. The nurse starts the majority of the appointments with a scan or photography or whatever else is needed. And sometimes it gives the clinician more authority when he then comes to sort of analyze the information in front of him, have a good sort of conversation with the patients, co-diagnose, etc. That person, if that clinician is the person who's scanning and then getting out the camera and doing those other things, you'd almost lose that clinical confidence and authority in the patient's eyes. And we found, again, we get much better uptake and understanding of our treatment plans when we are working with our wider team in a very sort of like protocol manner.
I think also patients frequently prefer actually speaking not to the
Absolutely.
clinician about things, don't
Absolutely.
they? And both nurses and TCOs are much better at articulating in layman's terms effectively to the patients what they can have.
Thank you.
That's why they always ask the question when they get to the desk. Don't they?
They do. Yeah. What did he say?
Do you agree?
Can you explain?
Can you explain what you just said?
Moving into patient expectations, there has been a huge boom in well-being consumerism. The amount of conversations I've had with people who say that getting younger people come in and they don't drink anymore, they're exercising a lot, they're very aware of their health, which is obviously a fantastic thing for dentists and dental team. How has this changed patient demands? Have you noticed this in the people that are coming into clinic to get treatment?
I mean, I've worked in the same area for 20 years now. So I've always worked in private practice in Canary Wharf. It's the financial heart of London. And when I started, the majority of my patients were, actually a lot of them were drug addicts. There was a lot of erosion from stress. Now that has completely flipped. And I see a ton of erosion from sparkling water. And we do have this huge wave of different ideals around well-being. So patients want different things. They're asking for different things now. So I have, a whole cohort of patients who last year were vegans, but this year they're carnivore. And they're asking for different types of toothpaste to match their preferences. Now it's like having to really stay up to date with not just what is, obviously it's all about what is research backed for me and what's right for the patient from a research point of view, but also at the same time speaking to their preferences and their needs and finding that you can strike that balance for them and decoding what their needs are depending on what they're telling you. So for me, my conversational piece in my appointments has got longer. The actual treatment time has got shorter because I need to decode what they're doing, what they're saying for me to actually be able to help them on a clinical level as well.
And I think it is. I mean, we've seen, not dissimilar from you saying with the sparkling water, we've seen smoking replaced for vapes, but it still causes damage, right? It's just different damage. So I think that's the thing. So whilst they may well have this healthy alternative lifestyle, it can incorporate other things that can give problems. I mean, it'll also be, feel like brushing my teeth today. So I'm not going to have to brush my teeth today. It's all that kind of stuff.
And how do you all think dental teams, dental professionals need to move to adapt to these new demands?
I think we need to understand the sort of the modern day patients or the new generation of patients coming through. They're certainly health focused, preventative focused, but also more aesthetically focused and more experience focused as well. So we have to adopt our patient journeys to integrate the technology, provide a great experience, and be better with our communication skills and understand that patient holistically and how we can integrate new developments into our dental treatments and dental diagnostics to provide a full holistic approach for that patient. The benefit of that type of patient is now we've got more patients who will at least attend the dental appointment, but that attendance is in search for a positive experience, where 10 years ago the acceptance was this is a negative experience and I really don't want to be here. That's completely flipped on its head. But now we've still got to adapt as a wider team to be able to provide that experience.
Yeah.
And part of that is I've seen patients really want convenience. So sometimes when patients inquire with our practice, they get asked the question, so this is automated, do you prefer a morning, afternoon, or evening phone call? So you've actually got somebody that takes evening phone calls, and then the normal staff that will do the daytime phone calls. So patients want to be contacted, at a time that's suitable to them. Maybe they're in work during the day and they can't be answering a phone call. So even simple things like just asking, when do you prefer to be contacted? What days do you prefer to come in for your appointments?
Yeah, absolutely.
I think for me, it's probably three main areas. I think with the aging population, the expectation of that population is much higher than it used to be. So no longer can you say, oh, you're a certain age, now you will have this. Try and push someone into a denture, and good luck with that. So people would expect to have the very best treatment through the 70s, 80s, and beyond. I think the other aspect is a lot more aware of the links of the holistic sort of health in terms of how the rest of the body may be affected, and they have a lot more sort of care about overall well-being. But there's also a bit of danger in terms of misinformation. There's quite a bit coming in, especially via platforms like TikTok and this that certainly myself or the government or the NHS is nowhere on. And we have to be, I think, as healthcare workers, be really careful, firstly, knowing the information, the evidence base for that, but also knowing that there's misinformation going out there and you need to address that. And I think those are quite relatively sort of probably the last 10-year issue that wasn't. But then when I qualified, in my 30th year, just going on to that, we used to have treatment. Do you remember those that are old enough, they said, oh, this treatment is for 18 to 65, as though once they get past 65, somehow this treatment is no longer doable, But nowadays, that has completely changed.
And with these changing expectations, how can teams keep not just accessibility, but also affordability at the forefront in dentistry?
I mean, for me, I speak to that with patients anyway, because when patients come into me, I'm not looking at what we're going to do, like how much can I get out of this patient? What can I do with this patient? The question is always, where do you want your mouth to be in 5 years' time? Where would you like your mouth to be in 10 years' time? And what's the most holistic and minimally interventive thing we can do to ensure that we get your goal, whatever that goal is? So I think that, if we speak holistically to our patients, and if we talk to them at the start of their treatment about, prevention, prevention's always cheaper than cure, always. So that's how we can keep costs low and access available for patients, because there's less to do because we're preventing.
I think with those two words, accessibility and affordability, I think a lot of the, let's say, trends that we're seeing in the modern day patients, they're two huge factors, which is part of their decision-making process. For us, accessibility and affordability isn't about cutting corners. It's about innovation and efficiency. If you get those two things right, then your efficiencies go up, your workflows improve, which improves accessibility for our patients to higher standards of care. And actually, in turn, we can actually make those things more affordable as well for the patients. And I think there's going to be a huge mindset shift towards some of these things as technologies, AI, new biomaterials come in. Gives our patients more choice, more customization, more control of the outcome, and then they can decide how they value their investment, then short, medium, long term, from prevention right through to whatever it is that they're looking for. And I think that's where the cost element comes in. It's like, what are my options, and then how am I going to value that investment? If we can standardize that to a way and make it accessible where the patients easily understand these things, I think then UK dentistry can thrive in a new way.
I think it is education as well, isn't it? Particularly around the aesthetic piece, because I know you, Robbie, feel really strongly about the whole, as we all do, the turkey teeth thing. You know, about educating patients that just because you think it's cheaper to go over there and have it done, it isn't actually cheaper in the long term, because you may well need a whole host of reparative, you know, repair work, restorative stuff when you come back. And actually there are other options. You don't necessarily need 12 veneers. You know, you may be suitable for bleaching, a bit of teeth straightening, a bit of composite bonding. So we need to make sure that there is more education around that on those social platforms as well.
Sure.
Yeah. Absolutely. I wanted to end on a positive note, because I think dentistry deserves some positivity, and that is this an exciting time to be working in dentistry? If somebody was going in to university now and they wanted to get a career in this area, would you recommend it?
I mean, we've talked about skills mix. We've talked about the fact that it's a flexible profession where we can have flexible working arrangements. We've talked about the fact that we help other human beings feel positive and happy about their mouths, and that people are living longer and expecting more from us. I mean, how could it not be considered a positive profession to work in? If you'd have told me, you know, when I was 21 and struggling to get a job other than a hygiene job, that I would be able to provide the kind of care that I'm providing now to patients, I would have been blown away. So, without a doubt, if somebody said, should I be a dental therapist, then I'd be pushing them into it.
Amazing.
Couldn't agree more. I think it's a very exciting time. I think anyone coming through, whether it's to be, you know, a dentist, a dental clinician, nurse, tech, whatever it is, I think the opportunities to thrive and have loads of career building opportunities within a larger style corporate model like Mydentist, I think that's going to be the new era of dentistry, and how I think the new professionals coming through should look at it. I think dentistry used to be considered a very lonely place. I go through university, I become a dentist, I have to buy my own practice. I think that mentality needs to change. I think it needs to be more of a community approach where we can have flexibility, shared care, you know, enhanced treatment planning, remote working situations. And that's very exciting. It's got to be, hasn't it, for anyone coming through?
Yeah, I 100% agree. I think with dentistry, one of the things that you get to do is you get to meet new patients, meet new people, possibly treat their family members and see them generationally. You know, you might see their children, their children's children, their grandparents, and build new connections that in other professions you don't quite get to do. So you can actually make a direct impact on people's lives and enjoy doing it. Yeah.
It is, isn't it? Because it's still a healthcare environment. So you still get that reward of being able to help people and help patients. But then within it, you've got all of this tech opportunities. You've got effectively the choice of a portfolio career where you can do a couple of different things within dentistry. You can work with a big team. You know, you can work by your own practice. There are just so many different opportunities within the profession. It is not just, I'm going to qualify, be a dentist and work in one room for the rest of my life anymore, is it?
I mean, Arno, we're having a conversation before about how actually things have been a lot more positive than what most people believe for quite some time. And as you say, there's so much opportunity. I'm conscious that I'm here, that I was supposed to be somewhere else where I've sent the recording, and that's based around career development. And the point that I've made on that recording is actually the vast range of what you could choose to do. And you could even do this almost subspecialised without being a specialist in very different clinical areas, as well as actually non-clinical areas, and how that is actually really, really exciting. And then add on top the technology and the whole team. And actually, if you think about it, we do actually have the most professionalised dental team in the world. You know, every part of our team is regulated. When I say regulator, and there's structure going all the way down, where they don't have that in the rest of the world. I think it's really positive.
Guys, thank you. That was an incredible discussion. It's now time for our last section, which is the Q&A. So I'm going to go and find the questions. Thank you so much, everybody who has contributed to the questions today. We've got some really good ones coming in here. So I'm going to kick off with, what do we need to do to make dentistry a career choice for the next generation?
I think it's just about being able to articulate to them everything that we've just said in the responses to those last questions. I mean, I don't know. I'm not involved in recruiting dental students things, and I'm not involved in terms of going to schools and talking to them about it, but I don't know how much they are told about dentistry and about, it probably depends where they go and do their work experience, right, in terms of what perception that they have of the profession.
I think it's more than that, actually. I think, you know, at the moment, if you want to go to a dental school, it is really difficult to get into a dental course. You have to really be the top of the top. You have to get the top A levels. And actually, if you wanted to be a dental therapist as well, that is extremely hard to get into a dental course as well. I mean, it was hard for me, but it's extremely hard now. We need to really look at who it is that we want to be a dentist in the next generation. Do we really want only the top high flyers, or do we want the amazing communicators? Do we want the people that, you know, are able to wait tables and make people laugh, but also care, you know, about people? And I think really, when you look at the next generation of dentists, can we not make it a little more easy for them to get into university when they are those personable people rather than just purely academics?
Yeah. For the past couple of years, I've worked with aspiring dentists. I'm quite heavily involved with that. And you know, I think with the work experience thing, it can be crucial in that when we're able to invite these aspiring dentists into our practices, we can show them the realities of it and why we enjoy dentistry. So that can filter out some of the aspiring dentists that actually aren't suited for dentistry. Maybe academically they're great, but they don't really have that communication part to their skill set, or they don't enjoy or are energized by meeting people. And for those that do want to make dentistry a career, they can actually see the positive sides of it, and then they're equipped with the experience to have strong applications to get into dental school.
Thank you. Jason, this might feel a little bit targeted to you, but I promise you everybody can answer. What do we need to do to retain more NHS dentists in the UK?
I mean, I actually think that everyone wants actually a well-functioning NHS. I mean, we've talked about quite a bit here, and there is no question that that the ultimate result, regardless of quite different sort of backgrounds, that we've all come up with fairly similar outlooks. So I think actually that everyone does. That obviously this big sort of reform piece that's going on, not just incremental but actually long term. I think that's, you've got to look at that. Government is fully aware of the issues, and it is now quite high in the priority. And there are, I'm trying not to talk too much about it, considering that all these things are currently being considered. But there are certain things, certain levers that you can incentivize for people to do that. So I actually think, you know, and the last set of stats are actually showing a recovery in that field. I just think that we need to get to a place where actually, you know, we can communicate that out. I mean, even, I think, was it Martha that was speaking, you can see how, you know, you can move from within one to, and sort of have a quite a varied sort of career and development. So, yeah, no question that the system needs reform. And again, I think part of the discussions that we've had has shown actually things are not as dire as what people say. And we were saying, would you do anything differently? You know, would you do any different career? So I think there's a big piece for government to do in terms of retention. There's no question that there's quite a bit of activity that's moved into the private market. But there's always going to be a need for that service, and there's always going to be a need because, you know, we talked about affordability just now. You know, if you look at the stats of disposable household income, etc., there's a very definite need for them to get that right. And most of the work we've done, I think, over the last 2-3 years has been knowing that the budget is limited, trying to make that budget aim towards those in the greatest need and with the less means. So actually we've been able to say, you know, we know there isn't the budget there to treat 100% of the population. There's probably about 50% of the population. So we've been trying to do that. But hopefully the reform will come along and change that. And we've seen more change in the last 2-3 years than the previous 20. Well, pre-06.
Thank you. Does anybody else want to weigh in on that, or should we move on to the next question?
I think it's just important. Part of the retention is also helping clinicians to understand what an NHS patient is. So people in this country still like to have the NHS as a point of entry into practices. Again, discussion I was having at lunchtime with a couple of clinicians. They said they've been surprised over the years how when you offer those NHS patients what all of their treatment options are, they will often uptake private treatments. So it kind of upsets me when people think they're just NHS clinicians, because you're treating a patient as a whole. The fact that their point of entry is NHS, it doesn't really matter. You can still offer everything to them. And I think we need to explain that better to the profession.
Yeah, absolutely. Thank you. I've got a great one here. What guidance and advice would you give to encourage dentists to try and take up the use of a therapist?
Oh, goodness. First, I wouldn't use the word use a therapist, because really we should be working together. So I would say if you want to work with a therapist, it's all about communication. So, having a look at your diary, I often do this exercise where we look at the dentist diary, we look at how many checkups they see, and typically it's about 50% of their time is taken up with recall exams. Okay, if we take that 50% recall exams out of your diary, how many more patients can you see if you were doing crown and bridge work, if you were doing implants, also all the fun stuff, and also having a therapist work alongside you, providing that preventative care, providing early intervention, the direct restorative care, getting your patients stabilized and ready for you to do the fun stuff. It's pretty much a no-brainer to do it. You just have to have that open communication with another clinician, put down the barriers of, I think there's a lot of people who have a bit of imposter syndrome about, what if they judge how my work is or what I want to do? Put down that imposter syndrome, lower those barriers, and talk about, okay, if you're going to do those kind of bits of work for me, this is the sort of communication I need. I need to have the scan. I need to have the photos. I need vitality testing, x-rays, whatever it is that you need as a clinician. And we all also have to understand that we're all different. So you can't have a blanket protocol across the UK. We have to sit down, dentist and therapist, specialist and hygienist, or whatever the relationship is, and work out, what is it that you need from me and I need from you. It's just a conversation.
I love working.
Sorry, you go first.
I love working with therapists, and I think it starts with a conversation. So I speak to my therapist and I say, what are you comfortable doing, and how can we make this partnership work? So my therapist will let me know if they want to be able to do new patient examinations, if they want to be seeing patients for routine exams, or whatever it is that they're comfortable within their scope. And I find that really does then motivate them to do all they can for our practice. And for me, it frees up my time to do the things that only I can do as well.
Yeah, I was going to say, therapists are really open to the approach that Kat's just explained. I really think the barrier here is the dentist, in all honesty. I feel like many therapists would sit down with a dentist that they want to work with and partner with, and understand what's the best approach to patient care, what's the best protocol to follow, where each individual is happy, where our scope of work is, where we want to, upskill in certain areas, and that partnership can be massively beneficial to the patient journey and to the clinic as a whole. So, it's empowering the therapists to work in partnership with the clinicians, I think, is the best approach.
I actually think that, if you speak to any, well, certainly when I speak to any dentist, and in particular young dentists, I said, what do you want to do? They always say, I want to develop, I want to build my skills in a particular area. So following on sort of Kat's stats, that we think somewhere between 70 and 85% of all the claims that go into the NHS could be carried out by a dental therapist. So, if you're spending 75%, let's say, of your time doing exactly that, then how are you actually then developing to try and work to the top of your scope of practice? I think that's, and the teamwork is absolutely key. I think quite often this argument gets into who's going to replace who, but actually it's not about that. It's about actually the team working together. And it can be a bit of an isolating profession sometimes. And having that is just, and having a team all working together is absolute key.
Yeah,
Well, this is the thing, we all know which dentist we would want to do our crown, and
Yes.
which dentist we would want to do our ortho, right? And it's
Yeah.
not often the same person. So that's where the therapist is crucial, because they can decipher where the patient should go when, and make sure that dentists can reach their full potential.
Absolutely, thank you. Thank you so much for such an insightful conversation, discussion today. Really appreciate it. I'm so sure the audience do as well. Thank you. It's been fantastic.
Thank you.